Scapula, in Latin, it is called as a shoulder blade. It is a thin bone placed posterolateral in the thoracic cage. It has two surfaces, three borders, three angles, and three processes. Side determination. The lateral or the glenoid angle, glenoid in the Greek is known as in socket, is large and bears the glenoid cavity. Dorsal surface is convex, costal surface is concave to fit the convex chest wall. The thick lateral border runs from the glenoid cavity to the inferior angle below. The two surfaces, costal surface, dorsal surface. Costal surface or the subscapular fossa. It is concave, directed medially and forwards. It is marked by the three longitudinal ridges. Another thick ridge adjoins the lateral border. This part is almost like the rod-like and act as a lever for the action of the serratus anterior in overhead abduction of the arm. Coming to the dorsal surface, it gives attachment to the spine which divides the dorsal surface into the smaller supraspinous fossa and the larger infraspinous fossa. These two fossas are connected by the spinoglenoid notch located lateral to the root of the spine. Superior border, lateral border, medial border. Superior border is shortest and near to the root of the coracoid process it presents the suprascapular notch. Lateral border is thick. At the upper end it presents the infraglenoid tubercle. Medial border is thin. It extends from the inferior to the superior angle. Three angles: superior angle, inferior angle, lateral or the glenoid angle. Superior angle is covered by trapezius. Inferior angle is covered by latissimus dorsi, which moves forward round the chest when the arm is abducted. Lateral or the glenoid angle is broad, bears the glenoid cavity or the fossa. This is directed forwards, laterally and slightly upwards. The supraglenoid tubercle is present above the glenoid cavity. Process: spinous process, acromion process, coracoid process. Spine or the spinous process is triangular plate of bone. It has three borders and two surfaces. Its posterior surface is called as the crest of the spine. Crest has upper and the lower lips. Acromion process has the two borders, medial and lateral, two surfaces, superior and inferior. Coracoid, in the Greek it is known as in crow's beak. This is directed forward and slightly laterally. It is bent and a finger-like. It is atavistic type of epiphysis. The complexity now arises to understand the attachments of the scapula. First, multipinnate subscapularis muscle arise from the medial two-thirds of the subscapular fossa. Second, supraspinatus arise from the medial two-thirds of supraspinous fossa including upper surface of the spine. Third, infraspinatus arises from the medial two-thirds of the infraspinous fossa including lower surface of spine. Fourth, deltoid arise from the lower border of crest of the spine and from the lateral border of the acromion. Here, acromial fibers are multipinnate. Fifth, trapezius is inserted into upper border of the crest of spine and into the medial border of acromion process. Sixth, serratus anterior inserted along the medial border of the costal surface. It has one digitation from superior angle to the root of the spine, two digitation to the medial border and five digitation to the inferior angle. Seventh, long head of biceps brachii arises from the supraglenoid tubercle, shortest head from the lateral part of tip of the coracoid process. Eighth, coracobrachialis arise from the medial part of tip of coracoid process. Ninth, pectoralis minor inserted into the medial border and superior surface of coracoid process. 10th, long head of triceps brachii arise from the infraglenoid tubercle. 11th, teres minor arise by the two slips from the upper two-thirds of the rough strip on dorsal surface along the lateral border. Here circumflex scapular artery lies between two slips. 12th, teres major arise from the lower one-third of the rough strip of the dorsal aspect of the lateral border. Here, the latissimus dorsi arise from the inferior angle. 13. Levator scapula is inserted along the dorsal aspect of the medial border from superior angle up to the root of the spine. 14th. Rhomboid minor inserted into the medial border opposite to the root of the spine in the dorsal aspect. 15th. Rhomboid major is inserted into the medial border between the roots of the spine and the inferior angle in the dorsal aspect. 16th. Inferior belly of omohyoid arises from upper border near the suprascapular notch. 17th. Margin of glenoid cavity gives attachment to the capsules of the shoulder joint and to the glenoidal rhabrum. 18th. Margin of facet on medial aspect of the acromion process gives attachment to the capsule of the acromioclavicular joint. 19th. Coracoacromial ligament is attached to the two borders, lateral border of coracoid process, medial side of tip of acromion process. 20th. Coracohumeral ligament is attached to the root of coracoid process. 21st. Coracoclavicular ligament attached to the coracoid process, the trapezoid part on the superior, conacoid part near the root. 22nd. Transverse ligament bridge across the suprascapular notch and converts it into foramen, which transmits the suprascapular nerve. Suprascapular vessel lies above the ligament. 23rd and last, spinoglenoid ligament may bridge spinoglenoid notch. Suprascapular vessel and the nerve pass deep to it.